Nguyen's been having issues with his sleep lately. On the advice of his care team, he's implemented a number of lifestyle changes, including adopting a healthier diet, quitting smoking, and exercising more frequently by getting out for walks with his daughter. He has two 60-minute naps every day, usually one in the morning and one in the late afternoon. Over the last few months, Nguyen has increasingly commented on challenges falling and staying asleep. He says that on average, he wakes up about 4 times throughout the night, and it's taking longer and longer for him to fall asleep each time. He wants to speak with his doctor to discuss what some of his options are to help him sleep better, and if sleeping pills would be a good fit for him. It's common for older adults to experience changes in their sleep. Many people find that aging causes them to have a harder time falling asleep, or that they wake up more often during the night and earlier in the morning. Since almost 1/3 of our lives are spent sleeping, reviewing the relationship between aging and sleep is a fundamental part of promoting overall health in older adults. According to the National Institute on Aging, it's considered a myth that older adults require less sleep than younger individuals. Many older adults have a hard time getting the sleep they need, but that doesn't mean they need less sleep. The amount of sleep that a person needs can decrease from infancy to adulthood, but this trend appears to stop around age 60. The Canadian 24-hour movement guidelines have recommendations around sleep. For those aged 18 to 64, set yourself up for 7 to 9 hours of good quality sleep on a regular basis, and 7 to 8 hours for those over 65. Consistent bed and wake-up times are also key. We've asked Dr. Tricia Woo to talk about sleep in older adults, as well as some of the evidence behind the use of sleeping pills for people with insomnia. Dr. Woo is a geriatrician and an associate professor at McMaster University. Tricia has a keen interest in interprofessional education and increasing the profile of geriatric medicine among medical students in Canada. She's currently the program director for the Geriatric Medicine Residency Program at McMaster. Let's start with the most basic things. Why is sleep important, and how does it change with aging?
Absolutely. Thank you for that question. Well, sleep is absolutely important for everybody's well-being. And as you go through the life cycle, the duration and amount of sleep that one has changes. And when you get to becoming an older adult over age 65, 7 hours, or sometimes even a little bit less. Now, of course, there's a lot of variability in these estimates. And many studies have shown that even people that sleep for as little as 5 and as long as 9 hours per night can be considered within the normal range. Now, as one gets older, not only the duration and the timing of sleep changes, but also the sleep architecture, or how we sleep. It may take a little bit more time for us to fall asleep. The quality of the sleep may not be quite as good. That depth, that REM sleep that we often look for, is not as present. It may be a little bit easier to wake up, and it's a little bit less efficient in terms of sleep. We do know that scientific evidence does show that sleep duration is linked to overall health and a general sense of well-being. People who sleep 7 to 8 hours a night do have good health benefits compared to those who sleep either shorter or longer duration.
So, what are some of the most common sleep problems seen in adults?
Well, there are many different kinds of issues that can arise with your sleep at any point being an adult. First and foremost, some people have difficulty falling asleep. That is with sleep initiation. Some people have difficulty with maintaining sleep, i.e. sleeping throughout the time period which they wish to sleep. Others will have difficulty with movement disorders, such as restless leg syndrome, in which their legs are moving and just agitating throughout the evening. Some people have REM sleep disorders in which they actually act out their dreams. For example, if they were dreaming they were boxing, they will actually mimic or posture as if they were boxing in bed.
That's sometimes one of the things that the spouse will report is that they may get kicked or hit or something.
Oh, like that. Absolutely. Absolutely. The other thing that bed partners can also tell about a person's sleep is whether or not they have a breathing disorder during sleep, such as sleep apnea. And in that case, the person that's sleeping will actually stop breathing for a few seconds, or seems like longer, but it'll only be a few seconds. And then they'll sort of startle and waken and take a big breath. And that is another thing that a bed partner may actually know more than the other person. Now, of course, if you have a terrible night's sleep, that's usually followed by excessive sleepiness during the day. You'll feel awful. You may need to nap in the daytime. You may have low energy. And this is a very distressing problem for many people. And not only them, everybody else in their household sometimes.
Are there other particular or common conditions that are often associated with sleep problems?
Yes, absolutely. For example, a large number of people have chronic pain syndromes for any number of reasons, ranging from osteoarthritis to, uh, nerve trouble, nerve pain. And certainly being in pain will not only make it difficult for you to fall asleep, but also have difficulty maintaining sleep and having poor quality of sleep. Other people may have other conditions such as depression or anxiety, which may be bidirectional in the sense that that may impact on their sleep and their sleep pattern, but then their sleep itself may then impact on the disease condition itself. So, for example, some persons with depression may have excessive sleep, and some may have difficulty falling asleep completely. Same with anxiety. Finally, some people do have other conditions, such as bladder issues, in which they have difficulty in maintaining continence over the evening, and they have to wake up multiple times, what we call nocturia, which is a symptom. And there are many different causes for that, but certainly that can interrupt your sleep pattern. And at the end of the evening, you will not be having a restful sleep.
Can you talk about some of the non-medication or non-pharmacological approaches to help with sleep?
Yes, absolutely. There are a large number of tasks and stage setting things that you can set up to ensure the best possible sleep quality. And some of these may take a little trial and error until you find the right strategy. On the plus side, there are very little downsides to any of these non-pharmacological solutions. Number one, set the stage. Have a nice schedule. Try to go to bed at a relatively set time each evening so it becomes a predictable thing. Number two, create a soothing environment. Make sure that room is set up to promote good sleep. The room should be quiet, dark, and relatively cool. Number three, during the daytime, if you can, try to get some physical activity, particularly early in the day. Having exercise or excessive exercise late in the evening actually would be counterproductive. But if you have exercise early in the day, that might help set the stage for the evening hours. While you're doing that in the daytime, try to get some sunlight. We do know that having adequate amounts of sunshine can help regulate your sleep cycle. And remember to dim the lights in the evening when it's close to bedtime. If you're on a number of medications, check those medications, looking for any side effects. Some medications may be stimulating and may not be taken or should not be taken later in the day. Other medications, such as diuretics, may cause you to wish to wake up in the evening to use the bathroom. Again, speak to your healthcare provider if you're on such medications so they can be adequately reviewed.
If you do have, ongoing issues with insomnia, one of the best evidence treatments now is actually cognitive behavioral therapy for insomnia. And this is, again, another non-medication therapy that has been shown to be very effective for people who are having difficulties with insomnia. And it may include some of the tips that you've outlined, but it also includes some other cognitive and behavioral strategies related to how you might track your sleep efficiently as well.
Yes, absolutely. And there actually is excellent evidence for that. And speaking to your own healthcare provider, your primary care team about what might be available in your local area would be a good place to start.
Are there particular medication strategies? People are always, asking about sleeping pills. So what are some of the effective medication strategies to improve sleep?
Yeah, well, I would sort of say before we talk about adding on medications, let's talk about what you're on currently and having that reviewed first. So I alluded to this in my previous answer, but take a look at your current list of medications and see if there are any medications that may be stimulating or may be impacting on your ability to sleep at night. And if you're not familiar with the medications, I suggest going through it with your local pharmacist or your primary care health team. Second thing is to look at your own lifestyle habits and things that may interact with your medications that you may be taking. For example, alcohol, caffeine, or even nicotine may be impacting or having an interaction with the medications that you're taking. And that must be considered first.
I think that's a great point about alcohol. A lot of people think, oh, alcohol, it's a bit of a depressant. It will help me fall asleep. But to your point earlier, many of the medications, as well as alcohol, can make for less efficient sleep. They affect that sleep rhythm or sleep architecture in ways that do not promote good sleep.
Exactly. And that's why going through the list and thinking carefully about your own sort of lifestyle habits and how that may impact on the medications is a great first place to start. Then, if you've gone through all of those steps and you're still having trouble, then it may be time to at least speak to somebody in your primary care team about medication specifically for sleep. And primarily, we're looking at medications that assist with sleep initiation. But the other thing to consider is if you're having other conditions such as chronic pain, restless legs, there may be other classifications of medications that may be appropriate to use. When you're talking about medications specifically to help with sleep initiation or sleep maintenance, there are several categories or types of medications that are commonly discussed in this area. For example, tricyclic antidepressants, such as nortriptyline, have been considered in certain populations. Benzodiazepines, such as lorazepam, oxazepam, or temazepam, have been discussed. Over-the-counter sleeping pills, such as zolpidem, zopiclone, and chloral hydrate, may be considered. For more difficult or atypical cases, other classes of medications, such as atypical antipsychotics or other classical antipsychotics, have been studied in the past. Now, the question is, how well do these medications actually work in providing sleep initiation and assisting with sleep?
Some of those same lessons learned, or some of those same findings, have come up more or less in sleep guidelines, and even some of the other reviews and evidence related to the use of medications to help with sleep initiation. The evidence is not really strong that they're any kind of cure, are they?
Exactly. The evidence is very soft, and particularly for persons with multiple other medical conditions or are on multiple other medications, the risk for potential harm or adverse outcomes from taking these medications is there. So again, this is not to be taken for a long period of time and certainly must be done under medical supervision.
I'm going to say that in terms of some of the other guidelines or things like the Choosing Wisely campaigns, what sometimes happens is somebody gets started on a sleeping pill to help short term with sleep initiation, but it just continues to be prescribed even if the benefits aren't that substantial. And as you say, somebody's not really looking at, well, what are some of the downsides as well?
Absolutely. And this can happen very commonly in any number of settings. In the clinic setting, you're having a difficult period for any number of reasons. You're initiated on a medication and then it's just never reviewed again. So that's important to loop back to the person that initially suggested that you take this medication and sort of say, is it doing what it's supposed to be doing? And am I at increased risk for having an adverse outcome? While in hospital, one of the classic things is most people actually have difficulty falling asleep, and sometimes are prescribed medications intended for short-term use. However, it's never discontinued on discharge from hospital. And sometimes people, again, can end up unintentionally or inadvertently on medications longer than necessary or longer than beneficial.
I guess, would it be fair to say, as a sort of bottom line summary, there are some sleep changes that occur with aging. Non-pharmacologic, non-medication approaches would be the best first attempt if you're having issues with sleep. If it's insomnia and it is persisting, you may want to investigate cognitive behavioral therapy for insomnia. Don't forget to take a look at your medications and lifestyle choices to make sure that there isn't anything in there that's interfering with sleep. And then as a last resort, a short-term trial potentially of some sleeping pills, but with that emphasis on the short term. Don't just start it and keep on going. Any other kind of final thoughts around things?
No, I think that sums it up very well. I think the other half of it is also to speak to people, speak to your healthcare providers, people that you trust, and always review and sort of say, is this still necessary? Where are we with the symptom? It is important to get a good night's sleep, but just be very mindful of medications and potential adverse outcomes from them.